Welcome to CareSmarts 360 on Air, a home care podcast. I'm Erin Cowell, Sales Account Executive at CareSmarts 360. I'm thrilled to be joined today by Mike Sokoloski, Director of Grassroots Advocacy at BAYADA Home Health Care and Hearts for Home Care. With deep experience building community connections and empowering advocates for home care clients, Mike leads the efforts that give voice to those who need it most. Today, he'll walk us through what's on the horizon for home care advocacy and how we can make an impact in 2026. Welcome to the podcast, Mike.
Thanks. Appreciate the invitation and the join. Happy to share how advocacy works when we collaborate with others in the industry.
Perfect. So we will jump right into the first question here. Mike, what advocacy trends will matter most for home care in 2026?
Yeah. So great starting point because it's the need has grown because of a lot of both federal and state uh, changes, major changes on the landscape. And one of those things are with legislative advocacy that we mostly do. We do some legislative and regulatory. On the legislative side, voices and personal stories really are what is most important right now in terms of moving the needle and getting collaboration from not just teams like us that do this for a living, but getting the stories from directly from the clients and the field staff so that legislators could hear these personal stories because their legislators are going to be visited 10 times a day by 10 different industries throughout the year when they have open office hours. And they're going to hear the same asks when it comes down to it. 99% of the time, it's about rate increases for whatever industry it is. We're looking at nurses, aides, therapists, etc. They're looking at different things. What really separates us, and I'm hoping the others aren't listening, but the what separates our industry are those personal stories.
Right.
When we tell how it is for the caregiver, how it is for the client receiving care, whether it's lack of available nurses or therapists or aides, and what that does to them, how it affects their families having to call off from work because there isn't someone to take care of their loved one, their child, etc. So that the utilization of the stories either through video, uh, in person in district meetings or at capitals, that would be one. Another trend, I say it keeps growing, is over the last few years. I'm 30 years in either one realm or another of healthcare. When I started, everybody was in their own silo in terms of organizations, associations. You didn't collaborate a lot, and now it's to the point where it's one big team.
Mm-hmm.
I think that trend is a huge positive force in creating the larger voice for especially home care recipients and the caregivers. Now we collaborate and we collaborate on the advocacy. That's where it ends, but that collaboration is really important that we get together and have one unified voice. So those are the two majors that I see.
Yeah. And how can agencies start meaningful advocacy without big budgets?
Yes. So, and again, everybody has to start somewhere. Usually they don't throw big money behind things like this unless they see some outcomes. So in the beginning, now versus years ago, technology has made this a little easier in that social media is one of those ways where your organization could share to their any of the social pages, especially LinkedIn, Facebook, and X. Those are the very popular ones to share and be able to tag legislators, either state or federal, with your personal stories that we just talked about, or concerns for rate increases, regulatory change that'll make caregiving easier. But putting that on your organization's page and then behind the scenes asking people in the organization through email dissemination or newsletters to share those, uh, like them, share them to their own personal pages. But the important part is tagging the legislators, their right by their right name, including specific asks, keeping it brief, and picture or video story with client and or field uh, engagement or interactions. That's one way. The second, I talked a little bit about the Alliance. So there are other organizations in home care and healthcare. The Alliance is, one of the biggest. It's actually the newest. But being a part, if you're an organization that's looking to get into advocacy, joining organizations like that or state associations as an agency, and then
Hmm.
that is extremely helpful because you're kind of getting a taste of what opportunities they could provide you. You have a say as a member of these organizations in what is getting done, and then you're able to respond to really light lifts like action alert emails that they'll send to you, either regarding Medicaid, Medicare, et cetera, that it's just a click of a button after you
Hmm.
validate what the language looks like, that you're comfortable sending it. And another opportunity with those same state or federal associations are attending lobby or advocacy days. They're referred to both ways, but again, the harmony, the collaboration by organizations, sending staff all to the capitals
Hmm.
and having meetings together, broken up in teams. You're not with your same employees. So you're going in with that one unified voice to these legislators, and they see you all saying the same thing. They're not tugging different ways.
Right. Yeah. And what role should clients and caregivers play in advocacy?
Yeah. One goes back to question one. I won't stay on it long with stories. So they have the capability to do that by either meeting with their direct constituent legislators in district or at the Capitol on those lobby days.
Hmm.
And I say direct constituent legislator, that's key for these consumers of home care or employees, is finding the right one. I'm not, you could go a lot of places. I'm not just making a plug, but again, on our website, like a lot of other websites besides Hearts for Home Care, you could do a find your legislator lookup. So we have it there where I just plug in my street address and city, tells me my state and federal legislators. So that's one way to do it, is
Oh,
you're
helpful.
get their details. Yeah, you're going to get their email
Yeah.
address. And uh, again, shameless plug, but I'd like to get the stories out because it is important. So we and others also have video components. So
Hmm.
just like you and I talking now, you can click a button on there and share your story, and it literally would directly go to the legislator. And they get these consumer stories and field employee stories that they record just by clicking a button. They could redo as many times as they want before they send or submit it. But that's a great way. The collaborative way in terms of internal, where field staff and clients come together, is the home visit. So Aaron, this is it of all the work I've done in the last 15 years. The home visit is the most impactful way. You're going to get a firsthand account where the legislator, state or federal, come into your home of a
Hmm.
client and see the care that's given, see the conditions, see what's going on day to day in terms of care, hear from the other people in the house working and what they have to do and the types of care and if there's call offs. Uh, a lot of changes by perspective of legislators have happened over the years when they actually go on these home visits. Some of them trying to cut checks to buy generators, real stories. We've had legislation passed by lame duck legislators uh, because they were so moved by the visit. They literally got their colleagues to initiate bills, based on it was screening of newborns to see if there's something that they could diagnose quicker. So yeah, these home visits, there's a lot more stories like that, but those are two that always resonate with me. That it's wild to get a lame duck, any type of legislator to get anything done. They're going out of office. It's usually not the time, and definitely you don't see legislators just trying to write checks to buy equipment for people.
Right.
So, those are definitely some of the ways.
Very impactful. And Mike, which policy priorities should agencies push for next year?
Well, one, you'll definitely love this based on what your organization does. So, technology adoption and and AI is definitely one of the majors. You have to be nimble. You have to pivot a lot now in home care in terms of how to make the best out of the time you have in terms of uh, getting the shifts covered,
Hmm.
being able to communicate with insurance companies behind the scenes, coordinating the care, calling and getting staff because recruitment is a huge issue in the industry. So AI and other technologies that can help manage cases, can help interpret. Again, telehealth, remote monitoring, a lot of these things all sync together in terms of just technology adoption and the AI itself working together. But I mean, I scrolling LinkedIn, you see now different uh, industry leaders promoting and choosing AI and saying it's safe. I mean, it's even something for me personally, very hesitant to be.
Hmm.
I almost felt like I was cheating.
Yeah.
I'll be clear. Like I was like, if I do this, everyone's gonna know, and the pushback is no, that's fine if everyone knows. It's better.
Yeah.
It helps guide you.
Yeah.
You could edit it, but it helps you. Yeah. So
Right.
those are, and then the other, I think a lot of times with any industry, there's a lot of regulation uh, that is now extremely burdensome, paperwork wise,
Mhm.
without it getting into the weeds, that we don't just advocate in the industry for rate increases. A lot of times it's things like that where there are some administrative burdens that don't need to be done as frequently as they do. It's just something that was passed in 1920 when home care and home health care and they wrote regs and they just don't get changed. So we do a lot of that as an industry. Uh,
Mhm.
and it's necessary. And with all these technologies that are advancing, it's actually helping Aaron in the give and take with the legislators because they see that this is something that will be beneficial to creating more access to care for clients in the home.
Right. And how can agencies use data to influence policymakers?
Yeah. So we have we'll go back to the lobby days, a great example in terms of the data and general meetings, but the lobby days themselves and the advocacy days we have in either the U.S. Capitol in D.C. or in the states, when you get together as teams, there's a structure to meeting with these legislators. The open introduced. This is Aaron with this agency, and I'm with this, and you cut through that. And there's always the open where we're here today to a lot of times ask for a rate increase to nursing, home health aides, et cetera. As I said in the beginning, you're getting 10 other people asking for rate increases for different things that are all probably valuable.
Mhm.
So when you say how data, well, our stories are super important, that's not changing, but you can't just say we need this rate increase because we need it to hire more nurses. We know that we're losing them.
Mhm.
If you could bring a rate study that shows what uh, employers of Target, Home, Walmart, Amazon are getting paid in the community versus what a caregiver in the home providing care to someone that if they didn't have it would need institutional care.
Mhm.
And no one's poo-pooing institutional care, but no one wants it unless they have to have it. So
Right.
to remain at home, we need more aides. This is what would you do? Like you put the
Mhm.
ask on them, would you do this for this much an hour or provide care to someone that needs to stay in the home, life sustaining sometimes care. So bringing the data where you see drop-offs in retaining nurses in the field, not just at your own organizations. Uh, when was the last pay rate? Bringing that type of data. There are some states it was, I think, one of them at 9 years. There hasn't been a rate increase.
Wow.
Cost of living adjustments alone, uh,
Yeah.
increases,
Yeah.
minimum wage increases that affect everybody else. Like you shake your head, and in a lot of
Mhm.
these meetings, they'll also come back at you, Aaron, with "We get it, we understand it," and then you'll tell them that. this type of care costs this, home care costs this. Like, yeah, that saves money. We see it like on these fact,
Right.
but yeah, we're still there every month, every
Right.
we're asking the same thing, and it's difficult. So yeah, having those data, fact points in the leave behinds that you will leave
Mhm.
the legislator, and being able to back it up. Uh, One thing with data that we teach our advocates when we have trainings, if you're asked the question or you're providing data, if it's true, stand by it and give it. If you don't
Mhm.
know, if you're guessing, never guess,
Right.
never guess, never make it up. Say, I'll get back to you. We
Mhm.
always tell our advocates that provides you another opportunity to meet with the legislator,
Right.
not lose trust immediately. So
Right.
data and stories are the top two. You're looking at the stories moving the needle on the heartstring, and the data making concrete decisions. If it's between one or another, you had the hard facts and you had the stories.
Mhm. And last question here for you, Mike. What common advocacy missteps should agencies avoid? And I think you just mentioned one when you're talking about those lobby days, but what other advocacy missteps do you see that agencies need to
Absolutely.
avoid?
Besides never ever making up an answer ever to look good in a meeting. Uh, the first one, I guess, we'll stick with the made up answers. So even if you're inside your own organization as a team, meeting with legislators or joining others in meetings, you'll get potential rogue advocates. So Aaron and Mike, they're going in there sticking to the talking points and the asks, and then you get one other person on the team that's there for the day, but they get a meeting with their legislator and they take an opportunity to talk about school funding, data centers, roads, something they try to get in a plug, and uh, it's being able to steer that advocate back and nicely say, make a separate meeting with the legislator. That's a
Mhm.
that's a great point that you're making, but we have an opportunity today to talk about home care. And so being able to politely steer rogue advocates during meetings is definitely a misstep that happens that you could correct if
Mhm.
if you're aware that this could happen, because sometimes you don't see it coming, and
Right.
there are horror stories that we've heard, and we don't like to add to it, so we talk about the rogue advocate all the time. Uh, Another misstep is if you and I don't live in the same state, this is really easy. Who to meet with. I talked a little bit about, find your legislator if you don't know who it is. Use a resource to find who your legislator is. Your direct constituent legislators are the ones that care and the ones that listen, because you're voting them in or out of office. If uh, Aaron is a legislator and I asked to meet with Aaron, and typically won't say no, but it's more difficult if I'm not a constituent, and they're not going to give enough credit to what I'm asking if I'm not one of their constituents. So making sure that when you coordinate meetings as an organization or get together with other groups, that you're meeting with your direct constituent legislator, not just anyone or someone you see on TV that you think that would be great to meet with them because they're always on TV and they seem popular. And the last, I guess, would be cadences. So mentioned about starting a program from scratch, and in terms of financial commitments or what could you do as a light lift. Meeting once or twice with that, either on the Medicaid side, a state representative or state senator, twice a year in their district office or once in district, and if you attend a advocacy day, but getting multiple touch points, face to faces with a legislator with the same exact asks, different
Mhm.
stories maybe, but it's the one thing about advocacy, not just in home care, all of it is a long game.
Right.
You're not going to a legislator's office to ask for a rate increase for the first time and getting it next week or next month. They need to see the masses, and that's why we try to elevate our voices over and over again with the same talking points. And that's why unity is so important. That's why you see a lot of the organizations come together, because they don't want to hear two large groups or factions with two different stories for the same industry. It makes it more difficult to get things
Right.
done. So on a, micro level, if your agency could have some of their employees meet with either state or federal officials, depending on if you're a Medicaid or Medicare type provider, that makes a world of difference in terms of the long game. And it is a long game. You do get rewarded if you're providing the data that's accurate and the stories and meeting with them over and over again. And they see that it's a real need.
Mhm. Well, that's really helpful, Mike. I really appreciate your input on this issue. Really appreciate you being here today. And to all of our listeners, thank you again for tuning in to Care Smarts on Air. And we'll see you again soon. Thank you.